So let's run through what happens as your skin ages. You see sun damage, diminished skin tone, fine lines, wrinkles, volume loss, and skin laxity. And we'll be addressing over the next few minutes each of these different problems that one sees. So let's take a look and see how the face ages over time. And if you see the split screen here, you can see the daughter at age 26 on one side and the mother at age 64 on the other. So what's happening here over time? So as you age, you lose facial volume, the contour of your face changes, and you see shadow patterns beginning to develop while youthful highlights skin tone begins to change. So there is this triangle of youth that we like to address and use this as a model for treatment. So typically youthful features will have higher cheekbones, fuller cheeks, a defined jawline, and also what you will see is improved skin tone or fresher skin tone and texture of the skin. So as you age, the triangle of youth becomes inverted. So rather than being an upward triangle, it becomes the opposite. So skin begins to droop, as we know, in the cheek area. You get flattened cheeks, a sagging jawline, and fullness under the chin, what we call a double chin. So these are features of an aging face. You begin to lose moisture and collagen. You develop lines and wrinkles, drooping skin in the cheek area, increased discoloration, brown spots, you get rough scaly spots, the precancerous conditions called actinic keratoses, as well as rough texture. One of the things my patients often complain about is diminished skin tone. This is particularly common in postmenopausal women, where as the hormones drop, you see a tremendous change in the quality of the skin, and it's the improvement of skin quality, which is something we can do very much or very well with our lasers, and I'll be talking about that. And of course, you see the sagging skin along the jawline. So there's also the changes in the fat pads as part of the aging process. You see hollowness under the eyes, you see loss of fullness and the flattened cheeks, the wrinkles and lines, not only just around the mouth, but also on the cheeks as well. And again, the sagging jawline. So what's happening here? Muscle movement, sun damage, all cause the loss of muscle tone, the lines caused by repetitive muscle movement, and the loss of fullness and contour in the mid-face and the sagging jawline. And then you have age-related facial bone loss, lowered angle of the brow, the bone which contributes to facial lines and droopy eyelids, larger eye areas, loss of jawline definition, a less defined chin. And what I would add to this slide is the status of your teeth. As people age, if they don't take care of their teeth, they'll see more bone resorption, and this can affect your facial features as well. So you can see how the face has changed over time from 20s up until the 60s and beyond. We're now seeing patients coming in their 20s who do something called prejuvenation, where they want to do something preventative to avoid the aging process that can occur. And I think a lot can be done early on. You can address the skin tone, you can address early signs of sun damage, and you can address the early signs of volume loss in the face or the dynamic lines that we often treat with Botox. And as people get older, you see the signs of aging with the skin. You get the brown spots and the wrinkles, and that we can address through the lasers that we have as well. So as I mentioned with the skin and aging, you do see the diminished tone and glow, sun damage and brown spots, the scaly patches, the precancerous skin lesions, and large pore size is something that we commonly see with the aging process as well. So what are the options in addressing these problems? Sun damage, we address through laser and chemical peels. I'm a laser guy. I've been working with lasers since 1983. I think lasers are preferable in dealing with sun damage. We'll be going into that, but by and large, we can do full facial treatments. We can treat the neck, the chest, the arms, and the legs with sun damage by using non-ablative fractional treatments or ablative fractional treatments. I'll talk about the differences there. Skin tone, again, I prefer the lasers for that purpose, and we have varying degrees of lasers in terms of downtime and recovery time. And then the fine lines, I like lasers for this purpose as well. And the deeper wrinkles, typically I'll use an ablative laser for this purpose, a laser that wounds the skin. And the volume loss, we use injectable fillers. The type of filler really depends upon what the patient needs. I personally prefer to use fillers that are reversible in case someone is not happy or has a rare reaction to a filler, that it can be removed. And I do it together with laser. Laser can be helpful for adding volume as well, depending on the type of laser that you use. And then there's skin laxity. You have the option of, with mild laxity, of using something like a laser or ultrasound device or radio frequency device. But once it becomes more extreme, then the use of surgery would be preferable. So I'm a big believer in combination therapy. And many of my patients have many of these things done together, even on the same day. So where I will use lasers, often a combination of lasers, injectable fillers, and Botox all on the same day. And there are those patients who will need all of the above, but may require surgery as well. So while I don't do the surgical facelifts, I do recommend them for a subset of patients. But our goal is to do as much as we can without surgery and to delay the need for surgery. And I believe that if one is proactive, the need for surgery becomes less and less over time. So let's talk about sun damage. This is the brown spots that I talked about, the diminished tone, the rough scaly patches, the enlarged pore size. So I'm a big believer of the FRAXEL. I actually helped develop the various different FRAXEL devices in terms of clinical development. The very first FRAXEL in the world was in our office in 2004. And then we helped develop the ablative fractional in 2008, and then the FRAXEL dual subsequently in 2011-12, and followed by the clear and brilliant, and more recently we've added the LASMD as well. So these lasers are great. I often use them in combination with the ruby laser for the larger sunspots, and subsequent to that we do advise long-term sun protection, that one takes care of their skin after these treatments, and long-term skin care using various products that can be helpful in maintaining the benefit of what we've done or performed with the laser treatment. So the skin care that we provide or suggest would be sunscreens for sure, topical retinoids or retinol, and various different rejuvenation creams. So for skin tone, the non-ablative fractional lasers, the FRAXEL, the LASMD, and the clear and brilliant are treatments of choice. Very little downtime with each of these lasers. The FRAXEL itself can have some downtime. We're talking about the non-ablative or non-wounding FRAXEL laser. This leaves a little bit of redness and dryness of the skin, little specks on the skin that look like pepper spots. And then the LASMD and clear and brilliant for the younger patient who's looking for improvement of their skin tone. And I would add to this also the PicoSure laser, which we use with a special lens, particularly good for patients with darker skin who don't want the downtime and are a little bit more sensitive to lasers we use for patients with lighter skin, and again, the skin care. So for fine lines, we use a non-ablative and ablative lasers. Ablative are lasers that wound the skin, and I'll show some examples, as well as injectable fillers. And again, we often do this together on the same day. So for deeper wrinkles, I believe strongly in the use of ablative fractional carbon dioxide lasers. That's the FRAXEL Repair or the Core. These are two examples of lasers that can be used. These wound the skin. These take longer to heal. Sometimes a non-ablative laser can be helpful for smaller wrinkles, but in general, we use lasers, and sometimes we use the lasers in combination with topicals. For example, we'll use topical Sculptra on top of laser-treated areas to enhance the effect of the laser to soften the wrinkles. And this has been a more recent advance that has worked out quite well for us. We also use ultrasound, such as all therapy. That can be helpful. There is a newer device called SoftWave, which is being investigated in our office, which will be released very soon, which I think will be the next generation of all therapy that should work a bit better. There are also radio frequency devices like Thermage, which is still can be used for this purpose. And we use fractional radio frequency with microneedles as well. In our case, in our practice, we use the Genius device, which works nicely for fine wrinkles or a little bit of fullness below the skin. Also festoons on the upper cheekbones. And in combination, we'll use the injectable fillers. And there are some patients, and I'll show an example, where surgery is the best bet. So laxity, mild laxity, lasers, the radiofrequency, the ultrasound. I use Botox for laxity. I do a fair amount of Botox along the jawline and on the neck, and this can help lift the skin. Fillers can lift the skin as well. So while I will inject fillers along the cheekbones to lift the skin, along the jawline to get some lifting as well. And if there's severe laxity, then surgery is your best bet. So let's show some images of what things look like. So on the one side, you'll see the skin that's wounded. That's with the ablative carbon dioxide laser, the FRAXEL repair in this case. On the other side is 1 day after FRAXEL, where the skin's a little bit red and a little bit dry. So where do we use these different lasers? And I'm big on the fractional lasers. Fractional lasers are lasers that are like pixels in a digital image. And this is where we use those lasers more safely than lasers that fully wound the skin. So we have less chance of scarring, less chance of whitening of the skin that we used to see with older lasers and also with procedures like dermabrasion. So with the non-ablative lasers, the lasers we use that don't wound the skin, very good for rejuvenation, pore size, fine lines, acne scars, surgical scars, actinic keratoses, which are the areas of sun damage, mild to moderate tightening, discoloration of the skin, some stretch marks, and sometimes melasma, but that's another story for another time. And ablative, where we wound the skin, certainly rejuvenation, pore size, fine lines, acne scars, surgical scars, some tightening, the deeper lines, and the festoons, which is the puffiness below the eyes. So here's an example where we just use a non-ablative FRAXEL laser, one of the original FRAXEL lasers, and you can see how the skin has improved quite a bit. The overall texture is better. And what surprised us, this is one of our early patients, is the fact that we were able to get some lifting of her eyelid. So if you look how the skin has smoothed out below her eyebrow, there actually is some lifting here as well. So this is all without any wounding of the skin. We were quite surprised by this, and I think this helped lead us to an understanding and the implementation of this fractional concept into the field of cosmetic rejuvenation. And then in the past 8 or 9 years, we've been using the FRAXEL dual. That's a different wavelength of light. It goes more superficially. It leaves this little bronzing of the skin, those little pepper spots that I talked about after the skin, a little bit of redness afterwards as well, which disappears over a few days. But look what it can do. So this woman comes in, and she's got sun damage. She's got some of the scaly spots, and you can see how the brownness is significantly better. Her skin tone is markedly better. The rough scaly patches are much, much better as well. So this is just a couple of treatments, 1 month after her second treatment, and you can see the results really looking quite good. This is one of our most popular procedures. It's easy. There's not a lot of downtime. It's not that painful. We do use a topical anesthetic. Sometimes we'll give a little shot for pain, like a shot of Advil or Toradol. Works very, very nicely for this. Another example of a gentleman with aging skin, and look how his skin cleared up with the FRAXEL dual laser with a series of treatments that worked out quite nicely for him. And another patient as well. In the case like this, we'll also add the ruby laser or a YAG laser to improve the discoloration of isolated spots as well. One of the beauties of this particular laser is that we can treat off the face very safely and effectively. And then there are milder lasers that we have, like the Clear and Brilliant and the LASE-MD. Really just for freshening of the skin. We use it a lot for some of the discoloration of the skin, like melasma or other light discoloration. Very little downtime. People can come in, have this procedure, and go right out, put some makeup on, and leave right away. Here's an example where Clear and Brilliant is utilized. Pre and post treatment, we're getting similar results with the LASE-MD. And here again, you can see the improvement of the overall texture and color of the skin. Here again, you can see how the quality of the skin has improved as well. So, sorry for the bloody photograph here, but this is the ablative fractional CO2 laser, the FRAXEL repair. And this is what the healing's all about. But we do show this photograph so people can understand that there's more of a healing process here. But the beauty of using a fractional laser is that you can heal much more quickly than you would with something that is fully ablative or wounds the entire skin surface. So most of the time, we're really just wounding 40 to 70% of the skin surface, allowing channels of normal skin to persist, which improves the healing process and also is much, much safer in terms of lowering the risk for scarring or changes in pigmentation over the long term. So I like to use this around the eyes quite a bit. This does require some specialized skill to do this safely. We do protect the eye, a little shield underneath the eyelids for safety purposes. But look how she had lifting. This is non-surgical. This is all with laser. She has tightening under her eyelids. She's got lifting of her upper eyelid. A nice result in a single treatment session. And here, a full face, let's go back here. Treatment was done. You can see we've got a little bit of tightening. The fine lines are significantly improved. If you look along the jawline, there's actually some tightening as well, and the improvement of the discoloration on the cheek with the brown pigmentation. Here's an older woman, and she has deeper lines, and this is after fractional resurfacing, single treatment session, improvement in terms of tightening and softening of the lines as well. Another example, these what we call corduroy lines on the cheeks, very common, can be improved. If they're very, very deep or if there's a significant amount of laxity, then somebody's better off with surgery. But here, the fractional carbon dioxide laser worked out quite nicely for this patient. And this actually surprised us early on. If you look at her jawline, this is all laser. This is non-surgical. You can see that there is some lifting here. Some patients with some loose skin like this can get a fair amount of tightening of the skin. This is all by laser treatment. But again, there is a healing process. It does take a week to 10 days. And then there's redness of the skin that occurs for a couple of months after the treatment. Upper lip lines, a big problem for many of our patients. A lot of women don't like this. It's a significant sign of aging. This again is with the FRAXEL repair laser. And here again, we've added the topical Sculptra to improve those lines as well. And this has worked out very nicely for that purpose. And the ability to treat the neck. We can't get the degree of tightening you can get from a neck lift, but we do get a fair degree of tightening with the treatment using this type of ablative fractional resurfacing, in this case, the FRAXEL repair. All therapy, again, this is what's called focused ultrasound. It can be helpful in terms of providing a little bit of tightening along the jawline, maybe a little bit of lifting on the forehead. The results are a little bit less consistent than I might see with a laser, but there are a subset of patients who can respond to that. And again, we're hopeful that the newer soft wave will give us a more consistent outcome using this type of treatment using ultrasound. Here's another example. You can look around the side of the mouth. You can see there is a bit of tightening from this particular procedure. Now, one of the things that we commonly see are these little pouches under the eyelids on the upper part of the cheeks. These are called festoons. And this is a procedure that we helped develop that we published in one of the plastic surgery journals using a technique of the fractional radiofrequency with microneedling. And to our surprise, we had some very nice results, something that we do now consistently. You can see how these flatten out. A very, very hard thing to correct surgically and often not successful with laser treatment. So there's a particular benefit to this type of technique, the fractional radiofrequency with the microneedling, which we also use for a little bit of tightening along the jawline and on the neck as well. So as I mentioned, we commonly add various different injections with our treatments. Botox, as everyone knows by now, great for the dynamic lines that move. Again, when we do the non-invasive treatments, we can do them the same day. Lines like this, the Botox can be helpful. Also, along the jawline. Again, we use Botox quite a bit here, again at the same time, or along the neck, where one has the band on the neck. That is a sign of aging. The Botox can be helpful there as well. And fillers, we all think of fillers where they can be helpful for rounding out areas of volume loss, as you can see on this woman's chin and the lines on the upper lip. But I also like to do a fair amount of this on the cheek just for lifting purposes, and again along the jawline for lifting purposes as well as under the eyes to fill out the hollows. I think that could work out quite well, particularly in combination with laser treatment. Here again, filler being used just to get rid of some hollowness that we sometimes see with aging, and again for lifting as well. Here, the lips become a little bit thin. By adding a laser, you can improve the lines, make them a bit fuller. I'm not a big fan of the huge lips, but I think you can make it look very natural with a modest amount of filling, just to avoid the signs of aging. And there are those patients where surgery is a better bet than what we can offer with the non-invasive treatments that I discussed. Here's a patient of Dr. Wilfred Brown who works with us in New York, and you can see improvement of her jawline and some lifting of her cheek. So an excellent result, also improvement of her neck. So a face and neck lift, something that's done, I think, better by surgery than what I can offer. Another example of a case of a woman who is better off as a surgical candidate than with a laser candidate or a combination of lasers and fillers, which I've been talking about tonight or today. So I'm open for any questions that you might have.
Perfect.
Risa, we have any questions there?
Yes, we have lots and lots of questions. Thank you so much, Dr. Geronemus. That was very informative. I really appreciate it. I'm sure I speak on behalf of everyone. So many of you were submitting questions during the webinar. We'll start getting to them right now. Anyone else that would like, on the bottom of your screen is a little Q&A. You can start typing them in there and we'll get to them if we can. So here we go. From Alana. There are many options for laser treatments as well as facial chemical treatments. Are there any facials or peels that provide similar effects for targeting precancer, anti-aging, and hyperpigmentation?
There are various different peels that can be quite effective. I prefer lasers. I feel I have more control with a laser. I can vary the depth of what I'm injuring with the skin or trying to treat by changing the parameters on the laser machine. And based on what I see in terms of real-time feedback as somebody who's experienced with lasers. So my preference is lasers because I feel I have better control and a more precise treatment and a more targeted treatment. But there are terrific chemical peels that can be done. There's some great physicians out there who do a nice job with peels. I just feel I can do a better job with the various different lasers that we have for better control and specific treatments, knowing exactly where I'm going at the right time.
Perfect. Okay, so I believe you may have answered this one, but which is the best laser and filler for lines above the upper lip?
I'm sorry, repeat the question. Fillers?
What is the best laser and fillers for lines above the upper lip?
So the best laser, it really depends on the depth of the lines. For deeper lines, I like the FRAXEL repair, which is an ablative fractional laser. There are other fractional lasers as well that can work nicely for that purpose. The fillers on the upper lip, you want to use something that's a little bit finer, like Juvederm or Restylane or Belotero. These are fine fillers that can be used without leaving any lumpiness or swelling in the area.
Very interesting. Okay. What is the best laser for small broken blood vessels around the nose, and how many treatments are required?
So I like to use something called the XLV, which is a KTP laser, and it uses a green light. It's a very, very difficult area to get a complete cure of vessels around the nose for some reason, maybe some underlying feeding of those vessels. Very difficult to treat, but we do see improvement. Sometimes the vessels are very large. In that case, I'll use something called a YAG laser, which can work nicely for those.
Okay, here's a good question from Melissa. I've heard of some doctors doing baby facelifts for women in their 40s. Do you agree with this, or do you think lasers are a better option?
Well, I think a baby facelift, and they're what people call mini lifts, really don't get to the deeper underlying tissue where a real facelift will get to. So I think these mini facelifts are very short term, leave a scar, and may not do very much over the long term. What I do think is that these patients who have mild laxity, we have lots of options between the lasers, the radiofrequency, the ultrasound, in combination with the filler and the Botox or something similar to Botox. So I would not be a proponent of surgery at a young age unless it's absolutely necessary, and that's very rare.
Okay. I would like to know how to do an eye lift above the eyes and eye bags without surgery.
Well, I think it depends on how lax you are and how deep those bags are. We can often do very, very well with lifting, as I showed in the presentation, with the ablative fractional, and sometimes with the non-ablative fractional. So that is one thing that I think is an alternative to significant laxity. But look, if this loose skin on the eyelids are covering your eyes, then you're better off with having surgery. On the lower eyelids, we can do a lot with non-invasive and also invasive. But if you do have real puffiness on the lower eyelids, true bags, then surgery is your better bet. But there's still a lot you can do with laser treatment under the eyes without the need for surgery.
Here's a good one from someone anonymous. Are these lasers safe on brown Asian skin?
So that's a really important question, and we spent a lot of time over the years working on darker skin. So we often have to modify the choice of laser and also the choice of technique. So both factors are very, very important in treating with dark skin. But yes, it is possible to treat dark skin. One example, as I briefly mentioned, the use of the PicoSure laser, which is great for dark skin. We use what's called the focus lens. And this allows us to treat dark skin without making it darker. One of the problems with treating dark skin is if you injure it too much, you'll end up with some worsening of the color or lightening of the color. You can also take the fractional lasers that we use traditionally and use them more conservatively and get a nice result as well. So the answer is yes, it can be treated.
Okay, here's an interesting question. Hi, Dr. Geronemus. Can you speak about your clinic's collaboration with international experts about the most advanced laser technology, namely lasers? I'm interested in technology coming out of Korea and how far they are compared to approved technology in the US.
So we work with laser companies and physicians all over the world, including Korea, Israel, Europe, and other locations as well, but those are the main areas. There's a lot going on in Korea, and we actually use quite a few Korean lasers in our practice, particularly from a company called Lutronic. And we must have 6 or 7 of their devices, and I think they're good quality devices. But we have over 100 devices, so we're looking for the best of class in all particular areas. So it doesn't matter to us where they're from as long as they're the best.
Okay. Can lasers get rid of scars like chickenpox scars from my childhood?
Yes, one of the real areas of focus of our practice in New York, the Laser and Skin Surgery Center of New York, is the treatment of scarring. And we have different lasers for different purposes, including chickenpox scarring, acne scarring, surgical scarring, burn scars, traumatic scars of various different types. So we use different lasers for different purposes. I can't say that we can remove them completely, 100%, but there can be significant improvement of scars, and that's a big part of what we do.
Great. Here's another question related to chickenpox. I had silicone injections over 30 years ago for chickenpox. Can I get laser surgery now?
You can get laser surgery. If you have a silicone bump, that's hard to get rid of, and we do see a fair amount of that. People who have little lumps and bumps from silicone that was injected many, many years ago. But it's not a reason or a contraindication to laser procedures. There are certain procedures where I would not necessarily do silicone, particularly some radiofrequency procedures.
Okay, let's see. Krista says, what is the best laser for spider veins on the legs?
Well, I think the best thing for red spider veins on the legs are injections and not laser treatment. Once one has deeper veins, large blue veins that look like ropes, then there's something called endovenous laser treatments that can be used. I don't do that myself, but we have a couple of excellent physicians in our office who specialize in that. They do it under something called ultrasound, which allows them to image the veins, and then they inject or treat the veins through the lasers into the vein itself.
Okay, great. All right, Wendy says, how many times a year can one have FRAXEL dual?
I think it depends on your skin. Everybody's different. I hate to give stock answers because everybody is different. You are different than I am, and the two of us are different than the next person. But I've seen some patients who come in every few months just to maintain the benefit because they like it. as I mentioned before, it's a very, very popular procedure. It's one procedure where I just generally do not see long-term complications. It's extremely rare.
Okay, we have a lot of questions left, so I appreciate all you typing them in. We'll get to as many as we can, but at some point we do need to break for dinner. But Dr. Geronemus, I know this is a little broad, but how long do the laser treatments results last generally?
That's a really good question. I think it depends on which laser and what condition you're treating and your age and how you take care of yourself. One of the things I mentioned is that post-laser treatment, we'd like patients to stay out of the sun and we put them on a topical regimen, but many of our patients do need maintenance. So let's say, for example, our popular procedure, the FRAXEL dual for the aging patient and sun damage, those patients need to come in at least once a year, sometimes twice a year. There's some patients who tell us they don't need to and they come back less frequently. Patients who are using the ablative fractional, the FRAXEL repair for deeper lines and wrinkles, we'd like to put them on a maintenance program with non-invasive treatments, and then we're able to defer the need for subsequent treatments, which may occur a few years later.
Okay, and this is from Krista. What is the best laser for slight laxity of the neck and under the chin for people who have a problem with hyperpigmentation?
Well, that's a good question. I still like the FRAXEL repair, and I think that can be done to avoid hyperpigmentation. I think the Genius radiofrequency with the microneedling can also be used on dark skin. We use that a lot on dark skin with acne scars, but it can be helpful in the neck and below the chin as well.
Okay, great. Let's see, Sarah says, what is the best rejuvenation for a woman in her 50s? A facelift or combined therapy? And do you recommend threads?
All good questions. So our goal is to do as much as we can non-invasively. So typically a woman in her 50s does not need surgery, but there are exceptions. There are some women who age more. They may have some genetic deficiency or, with elastin that may allow for more laxity than you might expect at that age. And there are other people who have had a ton of sun damage. So they have a lot of laxity because of, how their skin has been treated. So I prefer most of the time with a woman coming in or a man in their 50s, I would typically recommend the combined therapy of using the lasers or the non-invasive devices in combination with the injections, both the fillers and the botulinum toxin.
This is from Alana. Hi, Alana. How does the halo differ from FRAXEL? Would you recommend one over the other, and in what instance?
The halo is a great laser as well. I just have less experience with it. It can be used for non-invasive purposes and invasive purposes. But many times with the physicians, it's best to have the physician use what they're most comfortable with. But the halo is a great laser. The procedure itself is a little bit longer with the halo for non-invasive purposes in the FRAXEL. Most of my patients now that I'm from New York and work in New York, want something that's a little bit quicker. So they want to get in, they want to get out. And the FRAXEL is a little faster for that purpose. But there's certainly nothing wrong with the halo. It's a great device.
Okay. What, if anything, can be used on the blue veins around the orbital area or the cheeks?
So we treat this quite a bit, and we have some photographs of that on our website. And we use the XLV YAG laser for this purpose. It took us a long time to figure this out, how to do it correctly. I was working on it for years. But we do use this quite effectively for the veins around the eyes, under the eyes, and on the cheeks, those large blue veins. So years ago, I would have said, no way, it's not doable. Now we do it routinely.
All right. Is there a difference between ultherapy and thermage for tightening skin, and do either work for an older woman?
If you have severe laxity, I would say no. So if you have significant drooping, like the last couple of ladies that I showed in my presentation, I would not bother with either of those procedures. Those procedures are best for a woman, let's say in her 40s, 50s, 60s, with mild degree of laxity. And even then, I wouldn't have overly high expectations in terms of the degree of tightening. But again, this is an area that we're focusing on right now, where we're working on some newer technologies where I think that the answer to this question is going to change in the next 6 months to a year.
Very interesting. Okay, for volume loss in the cheek area, is there use of fat in your practice as a more permanent filler rather than regular fillers that are more short-term?
Yes, we have two plastic surgeons in our practice, Drs. Brown and Dr. Hoffman, and they do use fat, for that purpose. I personally prefer the injectables because one, they're reversible, and two, a little bit easier to perform. One doesn't have to go through a big procedure and take fat from somewhere else to put it in the area. But I do think fat can last longer and can be quite good. Slightly higher risk of being a little bit uneven and not being able to deal with the unevenness because you can't remove fat.
Got it. Okay, one person is asking for our website address. I can answer that one. It is laserskinsurgery.com. And at the end, I'll go over how you can get in contact with Dr. Geronemus if you would like a one-on-one consultation with him. Okay, let's see. This is not on the face, but it's related. Can anything remove lentigo brown spots from the legs, also from the face?
Absolutely. So the Ruby laser I talked about, or a YAG laser, or a picosecond laser, all can work nicely for that. It's an underutilized procedure. I'm surprised that so many people don't know that this can be done very, very effectively. And again, it's a big part of our practice.
Okay, this is a great question. From Lena, how often do we need to use lasers and how do fillers complement the lasers?
So fillers add volume. Some lasers can add some volume, and we're getting better and better at that. The combination of two, I think, is terrific, as I mentioned. And how often really depends upon your problem, how your skin ages, and how you take care of yourself. So it could be a couple times a year. It could be once every few years.
Okay, this is an interesting question from Judith. I had ptosis surgery a few years ago. I had Botox injected a few times without any issue, but the last time I had Botox, I got a droopy eyelid. The doctor said it was due to my ptosis surgery. Is that true, and can I still get Botox?
Each case is different, and I couldn't say that without evaluating you, so I don't know if that's true or not. But I think an isolated case of ptosis should not discourage you from trying Botox again. Just maybe have your physician change the technique or the amount of Botox being delivered.
Okay. We have time for a few more questions here, so anyone else wants to submit, this is a good time. Here's a good one. Is there any possibility of scarring from ablative fractional resurfacing?
Yes, there is a chance from scarring from anything that you do. That's why you need to be in good hands and you need to be followed very, very carefully. So if you're undergoing an ablative fractional treatment, one, you want to make sure this is the right laser for you. Two, you want to be in the right hands. You want to be in the hands of somebody who's experienced. You want to see their before and after photographs. You want to talk to them about how many times they've done this procedure. And the other point is that this type of laser treatment requires the participation of the patient. When I do a full face ablative fractional laser treatment, first of all, I want to make sure I'm around to see the patient afterwards. But also, I insist that the patient come back frequently after treatment, because the post-operative care, the post-treatment care is as important as the procedure itself. So in our hands, I must say, proudly I suppose, that scarring is rare. I can't say that it doesn't happen, but it's also something that can be corrected. So we watch our patients carefully. If we see any early signs of scarring, I believe we can stop it in almost all cases.
Beautiful. Okay, Pam has asked, what do you think about magnetic tissue tightening compared to oil therapy?
I don't know that much about it, and really would like to see more data before giving an opinion.
Okay, let's see. You said some new alternatives in 6 months to oil therapy in a year. Are you referring to software or what were you referring to?
Well, there's one company called SoftWave, which is FDA cleared now, using ultrasound technology like the oil therapy, but it's not focused. In other words, it's not delivering to a small area, it's delivering to a broader area. And I believe that it has the potential to be something better than all therapy. There are also newer technologies out there using a micro-coring technology that have the potential to be better as well. This is a non-laser, non-energy-based product that takes these little tiny holes, makes these tiny little holes in the skin and creating some tightening as a result of the healing process. And that looks very exciting as well. So those are a couple of things worth looking at, as well as continued improvement of this whole concept of the fractional radiofrequency with microneedling.
Perfect. Okay, this is interesting. How long does the laser improvements last? Which you already just stressed a little bit, but is it cost effective compared to surgery?
I think if you have significant looseness of the skin or laxity, surgery is a better option. If you don't, then you can do non-invasive treatment repetitively at much lower cost than the cost of having a facelift and undergoing a procedure with an operating room and anesthesiology and all of that. So it really depends on the patient, but again, much of what we're trying to do is to avoid the surgery to begin with.
Mm-hmm. Okay, here's one from Henry. I've had Botox to my forehead in the past from different people, but I'm afraid because my eyebrows seem to get lifted and look unsightly. How do you do this without that happening?
Well, there are some techniques where the eyebrow should not lift. And if you do have that problem where the eyebrows are pointed, what we call the Spock look, the eyebrows go up on the sides of the eyebrows, that's easily corrected. You know, a simple little injection can bring those right down. So if that ever happens, you're not happy with your Botox, go back to your doctor, have them touch it up. That's the best advice I can give there.
Okay, few more. This is from Marissa. Do you have a laser you recommend for preventative wrinkling?
Yes, I think for the younger patient, I like the Lays MD and the Clear and Brilliant. Non-invasive, non-painful, very little healing time, works quite well. The FRAXEL dual, can also be used for that purpose. Using that in combination with sun protection and skincare, such as a retinol or retinoid, really can help prevent a lot of the aging problems that we see.
Okay. Here's one from Randy. I was told the E-matrix would be a good procedure for acne scarring. Is that a good procedure?
It can be helpful. I think it's a bit outdated at the moment. I think the fractional radiofrequency is nice. The regular FRAXEL is nice for that purpose. Ablative fractional resurfacing. I think these are better options. I mean, the E-matrix is fine, but I think there are other options that are a little more advanced than that at this point in time.
Got it. And when is a good time to start getting fillers?
When you need them. Some people don't like the size of their lips. Other people feel that their cheeks are starting to drop, or they're getting the jawline, or they have hollowness under the eyes, or hollowness at the temples. And that's the time to begin.
Okay, here's another one about surgery. At the age of 70 and above, is it generally better to have surgery, or does it just depend on the particular person and how they're aging?
Everybody's different. 70 is not that old anymore. There are lots of healthy people at 70. So if you're in good health and you need the procedure, I don't see any problem with having it.
Great. Here's an off-the-face one. Can you do anything for sagging skin on top of the knees?
Good question. We in our office are doing some work with radiofrequencies such as thermage, the ultrasound treatments, and the fractional radiofrequency like the Genius, and that can be helpful for that. But if you have real loose skins above the kneecaps, I wouldn't expect to get much of a response.
All right. Well, we need to wrap this up. We are getting on to our hour right now, but I really appreciate everyone that tuned in for this. After you close down the Zoom, you will be getting a survey, and we'd love your feedback. Aside from our little technical difficulties, which we are aware of, any other feedback you have, we would love to hear. Otherwise, we really encourage you all to visit our website to learn more. It is laserskinsurgery.com. Our phone number, if you want to write this down, is 212-941-5050. I will type that into the chat as well. We are available for virtual consultations as well as some select in-person visits as well. So please call us and we can discuss live. I know a couple of you had questions asking when you could get in for ablative type treatments. And I think if you call, we can handle that on a case-by-case basis. So otherwise, a lot of you are saying thank you. So Dr. Geronemus, thank you so much.
Okay, my pleasure. Have a great night, everybody.
I really appreciate it. And we hope to see all of you guys following us on social media. And of course, coming up next week for our next webinar as well. So please stay in touch with us on social media. Get in contact if you'd like a virtual or in-person consult. And have a great Tuesday evening. Thank you, Dr. Geronemus.